You did everything right. You asked for help. You got a diagnosis. You took the medication your doctor prescribed, and you gave it a real chance. Weeks of waiting, side effects you pushed through, and then not much change. So you tried a different one, and maybe another after that. And somewhere in that process, a thought started to creep in. One that's really hard to shake. What if I'm just someone medication doesn't work for? If that's where you are right now, I want you to hear this clearly. That thought is not the truth. It just means you haven't found the right treatment yet. And there's an important difference. Here's something that doesn't get talked about enough. Standard antidepressants, the medications most doctors prescribe first. They genuinely don't work for everyone. Research shows that nearly 1 in 3 people with major depression don't get enough relief from these medications, even after trying more than one. That is not a small number. And yet, the standard approach is still the same. Try this one. Wait 6 to 8 weeks. If it doesn't work, try another. Wait again. It's a process that can drag on for a year or more while you're still trying to hold your life together. That's exhausting. And it's also not your only option, even if it feels that way right now. When depression doesn't respond to 2 or more antidepressants, there's actually a clinical name for it: treatment-resistant depression. And while that term might sound discouraging, it's actually an important turning point because it means the conversation can finally change. Standard antidepressants work by adjusting serotonin and other chemicals in the brain, and for many people, that's enough. But for others, the brain needs something that works on a completely different pathway. Not more of the same thing. They need something fundamentally different. That's exactly what the newer brain-based treatments do. And at BrainWell Psychiatry, these treatments are at the core of what we offer, because we see every day what they can do for people who had almost given up hope. The first is TMS, Transcranial Magnetic Stimulation. TMS uses gentle magnetic pulses to stimulate areas of the brain that tend to be underactive in people with depression. There's no medication, no sedation, no downtime. The treatment takes around 20 minutes, where you just sit comfortably in a chair, and when it's done, you can drive yourself to work, pick up your kids, or go about your normal day. It's FDA cleared, it's covered by most major insurance plans, and it has a strong track record, with many patients experiencing meaningful improvement after a full course of treatment. For some people, it's the first real relief they've felt in years. The second treatment is SPRAVATO, also known as esketamine. You may have heard of ketamine. It's been around for decades as an anesthetic, and yes, it has a bit of a reputation. But SPRAVATO is different. It's an FDA-approved nasal spray, administered right here in our office under medical supervision, and it works on a completely different system in the brain than traditional antidepressants, a system involved in forming new neural connections. What makes SPRAVATO remarkable is the speed. While a typical antidepressant can take weeks to kick in, many patients feel a shift with SPRAVATO within 24 hours. It's specifically approved for treatment-resistant depression, which means most insurance plans cover it for exactly the situation you may be in. It's important to know that neither of these treatments are considered experimental. They are real, proven, FDA-approved options. If you've been through the medication cycle and you're still struggling, you deserve more than just another prescription and another 6-week wait. At BrainWell Psychiatry, located in Bastrop, Texas, Dr. Sandra Duncan and the rest of the amazing team Take the time to understand your full picture, your history, your goals.